The general physical examination of the pregnant woman normally involves the exposed part of the body and provides information about the general state of health, build, hydration, vital signs, and then examination of the head, extremities, and then weight and height. But before that, we will have taken history and made a summary to involve the age, parity, occupation, followed by the key points of the history in 1 or 2 sentences. General impression about the state of health of the woman is being given, and we have moved on to inspect the eyes for pallor, looking at the conjunctiva, and looking at the sclera for jaundice, examining the tongue and the mouth and the teeth, particularly looking at the undersurface of the tongue. The neck is being examined for lymph node enlargements, and the anterior part of the neck is being examined for thyroid enlargement. Now, the vital signs are going to be taken, beginning with the measurement of the blood pressure, and following that, the pulse is taken. The radial pulse is usually what is taken, and then you move to the extremities, standing at the foot end of the bed, and check for pedal edema. You locate the medial malleolus and use the pulp of your thumb, press on it gently for about 10 to 15 seconds, and check for dipping, which will signify edema. We now measure the height, making the woman stand against a measured part on the wall and letting her raise the neck and look straight up. Then she stands on the scale for measurement of the weight. Then you come to the chest, bearing in mind to expose only the part of the body that you need. So at this stage, you see that it is the chest from the base of the neck to the upper part of the abdomen that has been exposed. We start with inspection of the breasts, taking note of the nipple, the areola, primary and secondary areola, and then you go on with your palpation. During the palpation, you palpate the 4 quadrants and the central quadrant, and also palpate the axillary tail of each breast. After examination of the breast, you go on to auscultate the lung fields, and you will auscultate anteriorly, going through the upper, middle, and lower lobes. And also going through the lateral portions of the chest. Then, whilst still on the anterior part of the chest, you auscultate for the heart sounds at the auscultatory points of the heart. Now you listen to the lung folds at the back. Again, going through the upper the middle and the lower lobes. For examination of the abdomen, you begin by exposing the abdomen from the zibisternum to the upper part of the thigh. Then you go on to inspection, looking for the contour of the abdomen, any fetal movement, any scars, or the presence of stria gravidarum and linea nigra, or any abnormality that you will notice. You then go on to palpation, and at this time you start with superficial palpation, going through the 9 segments of the abdomen. As you go on to do the actual superficial palpation, you ask the patient to show you whether any part of the abdomen is hurting, so that you examine that place last. In doing the superficial palpation, you will be watching the face of the woman to look for tenderness, and also you will be noting any masses that you find. You then move on to deep palpation, going first to palpation of the liver, and you go on to palpation of the spleen, and you go on to palpate the left kidney and the right kidney. You then concentrate on the detailed examination of the uterus. You start by estimating the fundal height. Having located the fundus, you do your tape measurement, measuring from the height of the fundus to the symphysis pubis. Your next step is the fundal palpation, which will get you to find out which part of the fetus occupies the upper pole of the uterus. Then you do your lateral palpation. The lateral palpation is done with your 2 hands. At one stage, you stabilize one hand and move the other hand. And then you do your pelvic palpation to palpate which part of the fetus is occupying the lower pole of the uterus. And then you estimate the descent of the head in the case of a cephalic presentation. You then auscultate the fetal heart tones using your fetal stethoscope. You then cover up the abdomen and thank your patient. In the superficial palpation, there is no area of tenderness. I palpate an obvious enlargement of the uterus. In the deep palpation, the liver is not enlarged, and the spleen is also not enlarged. The left kidney is not palpable, and the right kidney is also not palpable. The first step, location of fundal height with measurement of the symphysiofundal height. The symphysiofundal height in this case was 34 centimeters. On fundal palpation, a softish, ill-defined broad part of the fetus occupies the upper pool, and on lateral palpation, the back of the baby is on the right of the mother and the limbs were found to the left. Pelvic palpation, a roundish, well-defined, firm part of the fetus, the head, was occupying the lower pool of the fetus, and on termination of the descent, it was found to be 4/5. The back of the fetus is to the right of the mother, so on listening to the fetal heart tones, the fetal stethoscope is put between a line joining the umbilicus to the anterior superior iliac spine on the right. On auscultation of the fetal heart tones, I counted 35 beats in 15 seconds.